We are here today doing an educational video about PPCU and a little bit about endometriosis. My name is Melissa Dean. I'm the original founder, and then I decided I needed some help. So I brought on Dr. Mark Dassel and also Ashley Hendrickson. They're both my co-founders and doctor on the board. A little bit about PPCU. We are the Pelvic Pain Coalition of Utah. We help with all pelvic pain conditions. We offer support advocacy, community events, and like a big sense of community. We have been operating under Endo Warrior in the past. We had an Endo Warrior 5K last year, and we'll be doing one again this year. So I just wanted to introduce myself a little bit, and then I'll turn the time over to Ashley to talk a little bit about PPCU and also her story. I've had endometriosis for the past 15 years. I have had 8 surgeries, including a total hysterectomy. Now I have some ovarian tissue that's growing, so we'll deal with that. But endometriosis is just kind of take it as it comes, as you all know. And we have great specialists that help us with that, like Dr. Dassel. So I'll turn the time over to Ashley.
Hi, I'm Ashley Hendrickson. I have 5 kids. The Pelvic Pain Coalition, we provide education, support, and advocacy for individuals affected by endometriosis, PCOS, adenomyosis, and other chronic pelvic pain, diagnosed or undiagnosed. Me and Melissa both have been sick for basically decades. We just need to improve on that. I have had symptoms of endo since my first cycle, so about 27 years. The symptoms seem to change as it goes on. I've had over 30 laparoscopies, but they were ablation. It never helped with the symptoms, but I do believe it possibly helped me get pregnant. I had excision surgery September 2023, and I have felt insanely better 1,000 times. However, I'm having other issues with other parts of my body, so I'm going again to see what we can find.
Awesome. Thanks, Ashley. And then if Dr. Dassel, if you would just briefly describe what endometriosis is, and then why you choose to battle the incurable disease, and then we'll move on to some patient questions.
Yeah, sure. So, thank you guys for having me, by the way. And Melissa, thanks for getting me, and Ashley, thanks for, letting me be involved in PPCU, because I think it is so valuable, and like what you just said, Ashley, it's more complex than endometriosis alone, and it's more difficult, and treatments sometimes can be lifelong, that we're trying to really battle this disease. So, thank you guys for being here and putting all your strength into this too, because I think we all have the same goal, and that's to get, better quality of life for everyone suffering from this. I sometimes feel a little bit bad because I don't suffer from this. I see a lot of people who do, and I know that, and I hear a lot of stories, and sometimes we have big victories, and sometimes we're just continually fighting together. And, and at any rate, I appreciate people trusting me to help with this and help treat this disease, because I know it is bad, and it severely affects quality of life, and anything we can do to improve it. That's what we're here for. So, what you said, so endometriosis, right? So endometriosis, just its definition, right, is endometriosis is when the endometrium, the stuff that grows up every month inside your uterus, to kind of the soft cushioning that a fertilized egg would sit on to start growing a baby, right? That endometrium, when you're not pregnant at the end of the month, that's what comes out with the blood, right? That tissue-y stuff. When that grows outside of the uterus, anywhere outside of the uterus, that's endometriosis. Adenomyosis is similar. Adenomyosis is essentially that endometrium growing inside the muscle of the uterus. But still not in the right place, not in the cavity where it's supposed to be.
So we submitted questions from our Instagram and Facebook followers, and we got a couple people to ask some questions. So I thought it was important to address those. From Ash and Endo on Instagram, does taking birth control pills make it harder to find endo? And what about GR antagonists like Lupron or Lycia and Myfembree? Does that make it harder to detect during surgery?
Great question. We don't have evidence that says yes or no to that. And so that's not the end of the story on how to answer that question, but we don't have good studies that say, hey, we can actually see more when we don't use those medications. Now those medications, I've seen a lot of people say, hey, I don't want you to take anything before surgery because I'm afraid that we're not going to be able to see as much of the endometriosis. And I can't say that that is wrong either, because again, I would say there's not enough evidence. I don't have people come off of medications before surgery because I don't have the evidence to say there's any improved outcomes. And I'm afraid that people are just going to hurt more coming off of their medications prior to surgery. With that being said, even medications like the birth controls, combined oral contraceptive pills, so estrogen and progesterone pills, which are normal birth controls, right? Then progesterone only pills. Those have all been shown in studies that they can shrink lesions. Endometriomas are the easiest one for us to see on imaging. And so we know those all can shrink those. Every one of the medications we just mentioned can shrink those. But those aren't going to be something you're going to shrink and you're not going to be able to find, right? Deep infiltrating endometriosis. There is a good study, and I believe it's out of Italy, and it was a couple of years ago. They looked at MRI because now we can see reasonably with MRI. At least deep infiltrating endometriosis is big enough. And they did find lesions either shrunk or stayed the same in 89% of patients with one of these progesterone-only pills. So, and then there's also evidence, just as an aside, that some people get just a ton of relief from that hormonal medication with deep infiltrating endometriosis. So even though deep infiltrating endometriosis, a lot of times we are kind of thinking down a surgical path, it's not always a surgical path that's necessary for that. And I have a lot of patients who are on those medications and are thriving. We just make sure we follow and make sure growth isn't happening and pain isn't recurring.
Awesome. Thank you for the answer. We have one more question from Mano on Facebook. How can endo be detected other than a laparoscopy? What diagnostic tools do you use?
Yeah, so you can see endometriosis on ultrasounds, CTs, MRIs, etc. However, it depends on what you're looking for, right? With an endometrioma, right, that's a cyst in the ovary. They're usually big enough where we can see them on a lot of things. And we can even see them on CTs. CT is the worst imaging for endometriosis. I mean, maybe there's some other technique that I'm not thinking of, but for the most part of the big ones, it's the one that's the least effective. It can show you there's a big cyst, but it can't tell you whether it's endometriosis or not. It just tells you yes.
The CT doesn't show soft tissues as well as MRIs, does it?
That's exactly right. Right. So it just doesn't show those soft tissues well. I mean, you can see it, you can see the cyst, you just can't characterize what it is.
Right.
The MRI is super effective at looking for endometriosis lesions, deep infiltrating endometriosis lesions especially. But, and this is probably changing as we're moving along, but the commonly held knowledge of if you have deep infiltrating endometriosis less than 1 centimeter, you might miss it. Also, it's hard because it matters what the radiologist, how skilled your radiologist is. There's also certain protocols we do for the MRIs. So certainly it doesn't every MRI isn't the same.
Right.
Ultrasounds can be the same way, super helpful. It does remain to be said that even when we look at MRIs, ultrasounds, CTs, whatever we got, we cannot reliably find superficial endometriosis. And superficial endometriosis can be just as painful as deep infiltrating, just as painful as endometriomas. And so we cannot, one thing I always tell people is we can't tell you don't have endometriosis by looking at any imaging. The only way we can tell you do not have endometriosis is through surgery. And that's a bummer because not everyone should get surgery all the time. But definitively, we can never say, no, you don't have that, just based on imaging.
Right. Okay, cool. And
Yeah.
then we just wanted to talk briefly about a couple of events that PPCU is putting on. We are holding a cannabis for pain class on January the 31st. It's a Saturday at 11 a.m. at Utah Grown downtown. To be teaching us how to make your own suppositories with cannabis products. So if you don't have a cannabis card, no worries. You can come to the class. You have to be 18 or older to attend. The ticket is $5. Come to the class, learn how to improve your pain with cannabis, and then if you would like, you'll be able to get a card and step across the street and purchase any products that you might want. We're also doing our big event. I'm excited to announce we are going to have a second annual Endometriosis Warrior 5K. It's going to take place on Saturday, March 28th at 8:30 a.m. start time at beautiful Wheeler Farm. It's a beautiful course throughout the property to do the 5K on. Children are welcome. Animals are welcome. We'll have a photographer on site. Chick-fil-A is doing a catered breakfast. We hope to raise enough money with the events that we're doing before the race to have things like blow-ups for kids, t-shirts and products to purchase, ending finish line with a time so we can record people's times. Just make this year bigger and better, raise more money to go towards endometriosis research. Thing to add, Ashley or Dr. Dassel?
A little bit about our seminar at the end of the month. You don't have to have a uterus to come support us. So bring your families and let's do it.
Awesome. Thank you. And thank you for answering those questions, Dr. Dassel, in such a way that you always do. You're wonderful. The things that you do for the endo community are wonderful, and we thank you.
Thank you so much.
You can purchase tickets for either event at our website at www.ppcuendowarrior.org.